Dr. Bridget Wynn.
Hi, I'm Sean.
Nice to meet you.
Nice to meet you.
So what brings you in today?
So I've been having some pain in my right big toe. I want to get it checked out.
Okay, we'll definitely get that checked out. I'll ask you a few questions about this. Was there any event or activity that causes pain?
Yeah, I stubbed my toe pretty bad.
Okay, and you said it's right here on your right hallux on the medial side.
Mm-hmm.
Okay, how long has this pain been happening?
About a week now.
A week? Would you categorize it as sharp or dull?
I'd say it's dull.
Dull? Does it radiate out anywhere?
Yeah, just kind of big toe.
In the big toe. Is there anything that aggravates the pain?
When I wear shoes. Yeah.
Okay, does anything alleviate the pain?
I'm trying to soak it in warm water and it seems to help.
Okay. Would you say it hurts more during the day or at night?
It's pretty consistent.
Consistent?
Constantly, yeah, it kind of constantly hurts.
Okay, and then on a scale of 1 to 10, how would you rate the pain?
About a 5.
A 5? Okay. Awesome. So we will get that checked out today, but I'll ask you a few questions about your medical and social history.
Okay.
Have you ever been hospitalized or had any surgeries?
No.
Do you have any major illnesses, either as a child or as an adult?
Nope.
No. Are you up to date on your immunizations?
Yes.
And do you take any medications?
I do not.
Do you have any allergies?
Nope.
Have you had any blood transfusions?
No.
Patient is aware and alert. So about your social history, are you married?
I am not.
Are you in a relationship?
Yes.
And do you practice safe sex?
I do.
Yeah. How would you say your sleep is? How many hours are you getting a night?
Well, that's pretty good. I get about 7 to 9, I'd say.
7, that's good. Do you smoke, drink, or do drugs?
I don't smoke or do drugs, but I'd say I have a couple drinks a week.
A couple a week, okay. How would you say your exercise is?
It's pretty good. I exercise a few days a week.
A few days a week. And how would you say your diet is?
It's decent.
Decent. What do you do for work?
I'm a software developer.
Software, so you're sitting for most of the day?
Yeah.
Yeah.
Most of the day.
Okay, do you have any pets?
I have a dog.
A dog, awesome. And have you traveled outside the country anywhere?
I have not.
The last couple weeks?
No.
No. Regarding your family history, so your parents or your siblings, do they have any major illnesses I need to know about?
No, just high blood pressure.
High blood pressure, okay. So we're definitely gonna check that out. So I'm gonna start with the physical exam. We're gonna go and I'm gonna check your pulses. Okay, so right foot, dorsalis pedis, 2 out of 4, which is good. Left foot, dorsalis pedis, 2 out of 4, that's good. I'm gonna go right behind here, and this will be your posterior tibialis. Right foot, 2 out of 4. Left foot, 2 out of 4. And then I'm gonna go for your popliteal, which is behind the knee. So I'm just gonna come in here. Left, 2 out of 4. Right, palpable, 2 out of 4. So all your pulses are palpable and symmetrical, 2 out of 4. For skin elasticity, so I'm just gonna check for the turgor. So I'm gonna pinch a little, have it come back. Left side, good. Right side, good. I'm gonna check the temperature. So warm to warm, bilaterally, awesome. And I see hair growth, bilaterally. And let's see, I'll have you actually lay back and scoot so that your feet are just dangling. Perfect. So I'm going to check your capillary refill time. Capillary refill on all 10 toes are good. I'm going to check for your skin, so do a little derm exam, make sure there's no open wounds or macerations. So far I see none on the left and none on the right. I'm going to check in between your toes for any macerations. So if I see any cuts or wounds, nothing in between the right toes, nothing in between the left toes. Let me check the bottom of your feet. So I do see a few calluses, but other than that, no open wounds, no macerations. And I'm going to check up here. I'm going to lift your leg up and check. Nothing on the right side. Nothing on the left side. Perfect. Now I'm going to check your nails. So your left see nothing on the left side, nothing abnormal. On the right side, I do see what you're saying is inflamed over here on this nail, and that hurts.
Yeah.
Okay, awesome. That's something we'll look for. So now I'm going to do the musculoskeletal exam. So you're going to tell me, or you're going to push against my hand. So wherever they are, I'll tell you to push. So push towards your face. Okay, strong. Push out. Strong. Push down. Strong. Perfect. And push in. Strong. Okay, awesome. And now I'm going to check the range of motion in each of your joints. So we'll start here. First ray. Good. Range of motion. 1 to 1. Okay, we'll do mid-tarsal. Okay, good. Range of motion for your subtalar. Good. Okay. First ray, 1 to 1. Range of motion intact. Mid-tarsal. Intact. Subtalar. Intact. Okay, now I'm going to check your ankle. So I'm going to put you in subtalar neutral. So just relax. And then I'm going to dorsiflex. All right, so a little tight on the right foot, and then I'm going to have you bend your knees. You have 90. Oh, perfect. So you see that goes a little bit further in. Now I'm going to do the same on your left. So I'll put you in subtalar neutral, dorsiflex, and then push against you. Okay, so it's a little tight, and then have you bend your knee again. Awesome. So range of motion is normal and intact for all of the joints. We're going into the neuro exam. So I'll have you look up for just a quick second. So this is Sam Weinstein's monofilament, and I'm going to just poke your bottom of your foot and the top of your foot, and you'll just say yes if you feel it. It's not that sharp at all. So I'll have you close your eyes and just say yes if you feel it.
Okay. Yes. 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 Yes.
Okay, right side, good.
Yes. 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 Yes.
Left side, good. Next I'm going to do a sharp dull test. So this is just seeing if you can tell the difference between sharp and dull. I'll show you what they feel like, and I'll have you keep your eyes closed during that. So this is an example of sharp.
Okay.
And this is an example of dull.
Okay.
So just tell me if it's sharp or dull.
Okay. Sharp. 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 Dull. Dull. Dull.
Okay, perfect, thank you. Next I'm going to do proprioception, so keep your eyes closed, but I'm going to have you see that either say up or down. So up is towards your face, down is away from your face, and then try to tell me which toe I'm moving.
Okay. First toe up. Third toe down. Pinky toe up.
Okay,
Second toe up. Pinky toe down. Big toe down.
okay, perfect. Next I'm going to just test for vibratory response. So you're going to tell me, do you feel vibration, and then when it stops.
Alright.
So,
Feel it. Stop. Feel it. Stop. Feel it. Stop. Feel it. Stop.
okay, perfect. And then I'm going to test your Babinski reflex. So you don't have to do anything, just stay right there. Okay, perfect. And you have a normal Babinski sign. Awesome, and then I'll have you sit up and then scoot back towards me.
Alright.
And then we'll test your reflexes on the wrist.
Alright.
So we'll test your reflex here. Perfect, intact. Perfect, reflex intact. Intact. And this is your Achilles, so that is intact. Awesome. So let me check your foot again, the part that hurts. So I see some erythema here on this medial side. And tell me if this hurts.
Yeah.
Yeah, that hurts. Okay. So what I kind of suspect is onychocryptosis, which essentially is just an ingrown toenail. I'll go through what we're going to do today. So we're going to go through like a partial nail avulsion. So basically I'm just going to cut that part of the nail out and we'll remove it, and we'll do that right after this.
Okay.
I'll send you home with a prescription for some 800 milligram ibuprofen, just for 3 days as needed in case it does still hurt, but this should alleviate the pain immediately. We're not going to get any x-rays, you don't really need that, and I'll have you follow up in about a week just so we can see how that's going, and you're going to continue care with me, so they'll just make an appointment for you to come back in a week.
All right.
In terms of the future, I'm really sorry you stubbed your toe, but we'll definitely look into different kinds of shoe gear so that you can have a bigger toe box. Do you have any questions for me?
I do not.
No? Okay, awesome. So yeah, right after this, we'll have you move into the next exam room and we'll get that ingrown toenail out.
All right, sounds good.
Awesome. It's nice meeting you.
Nice meeting you too. Thanks.